Hello, hello, hello. Assalamu alaikum. Ji ayanu pakhair ragale ni hama shumme washmale. Oh, hi, Gonzaimus, Guten Morgen, and thank you very much for tuning into PTY. You are watching What This Morning alongside Maha and Shazad. Hello,
Yeah,
Maha, how are you?
I'm very good, Shazad. Actually, have been better because I'm still not feeling 100% yet.
Yeah, I think that's pretty much the case with all of those Pakistanis who are outside as well, because I think this is what's going on with me, my makeup department. You know, majority of the people within over there, they are not even feeling well, and it's because of the fact that the weather is changing. It's, you know, it's a transition from warm weather to very chilly and cold weather as well. So
Yes.
people, if you're out there, please look after yourselves. There are flu vaccines which are available. And if in case you do not know what to do, please consult your doctor. This is something which is very essential because healthy living is what makes you a better human.
Exactly, because if you don't have your health, then you're not going to be able to be very productive. And actually, today we're going to be observing World Stroke Day.
Yes.
And actually, it wasn't today; it was yesterday,
Yes, it
correct?
was yesterday.
And the thing is, around 15 million people suffer from a stroke worldwide. About 5 million are left with permanent disabilities as a result of the care or not being able to pick up the warning signs when it's happening.
And you know, whenever we talk about strokes, I think over here within Pakistan, I've seen majority of the cases. Well, you know, the thing is that for all those people who are suffering through such a disease is because of the fact that they didn't take all of those precautionary measures. And the signs are always there, they're out loud, but then, you know, half of the time we still feel like, you know, even if there's somebody who's a blood pressure patient, they'll still have the medicine in their pocket but won't eat it. And then there are people who have disease as a sugar, all right, diabetes, which is a disease, and then, you know, before eating a meal, they'll think that, you know, okay, if I have taken my medicine or after the meal, that's what makes me perfect and I can eat whatever. But there are all of these reasons which build up towards a stroke. And this year's theme was Face the Fact, Stroke is Treatable. This is
Yes.
what this year's theme is, and today we have been joined by two amazing people over here who are experts, and they're going to let us know what we are supposed to do.
Exactly. So we have been joined by Dr. Memoona Siddique. She is a consultant neurologist. I'll get the word out. Thank you so much for joining us. Besides Dr. Memoona Siddique, we have been joined by Dr. Farhat Shoaib, who is also a consultant neurologist. Assalamu alaikum. Good morning. So we'll start with you, ma'am. So what is a stroke?
Okay, basically, stroke is when the vessels which are supplying blood to the brain they get blocked either, or there is rupture of that vessel that leads to the weakness of one side of the body, or there any other focal neurological deficit because of that, and that is called a stroke. So this is basically a neurovascular or a brain disorder, and it's one of the leading cause of disability worldwide, and third leading cause of death in US.
Okay.
Obviously, but then at the same time, you know, since we're talking about stroke today, and we'll obviously try to highlight or probably make people aware of what it is, or you know, what are the early symptoms and how it goes about. But then there's one more thing which I wanted to ask, that a lot of people, they confuse stroke to a heart stroke as well. So please let us just make sure that you know what is the difference between a heart stroke and this one, which is a neurovascular, right?
Yeah. So basically, stroke is brain attack.
All right.
Just like when the vessels of the heart got blocked and you have a heart attack. Similarly, when the vessels of the brain got clogged or there is rupture, so the part of the brain got affected. So now we are promoting the term, brain attack, because it not only gives you a clue that this is a brain disorder,
Yeah.
and it also signifies that it's an emergency, just like a heart
Heart attack.
attack.
Okay.
Thank you very much for doing that, because other than that, I think people would have been very confused until now. It took us quite long to promote this term,
Yeah.
brain attack. But Dr. Saab, moving on to you now, how would you highlight the importance of this day, first of all? Because over here in Pakistan, I know that the situation is very dire.
I mean, as you were saying, there's a lots of awareness about heart attack, and still, as we have started a stroke center here, we see lots of patients who normally get any weakness or any effect on the left side because of the stroke, but their first port of contact is always a cardiology center. So they go to a cardiology center, they get assessed there, and then I mean, after all this discussion, they find out that this is a
Very correctly said.
yeah, and then they are referred from the cardiology centers to us. And now, as this year's theme is stroke is treatable, and for treatment of stroke, each and every minute is important. And that crucial time that is wasted in that initial time when patients go to a cardiology center and then they're assessed and they are diverted to us. So that time we can't get it back.
All right, very correctly said, and I think I would love to have a minute with our viewers as well, because I've had a situation like this within my own families, and I've gone through that, so I can better explain. So, you know, one of my uncles, he went through this situation, he had a stroke, we didn't know what happened, so all of us very correctly said we thought that it's a heart attack. So now what we did was that we put him in the car, we went to a cardiology center, and then when we went over there, after assessing, it was like after an hour or 2 hours, they said, we cannot keep him over here because it's not our relative field. Now, at that point of time, what can you do? Because you are obviously, you know, you do not have any clue what's going on, and there's life at risk. So then we had to move to 2 different hospitals before we reached to the destiny where actually the treatment was available. So people, please be sure. Well, in fact, you know, I think that raises a question as well. For somebody who fainted right in front of you, the first thought is that it's a heart attack. And now there are no symptoms whether it's a brain attack or a heart attack. So what can a person do?
I mean, there are certain features that even a layman can identify. I mean, there have been multiple campaigns in whole of the Western world, and there are different validated tools that can be used. So fainting is something different, but there are few features. They are most common in most common types of the strokes, like weakness on one side of face, problems with the speech, or weakness of one arm and one leg. So this is a campaign which we are using. Is called FAST, F-A-S-T, where all these letters in the word, they stand for each symptom, like F for face, A for arm, S for speech, and then T is time. That
You
we were
left the
discussing.
leg out though.
Okay.
So these are the 3 features that can be identified by any person, anywhere, in the shop, in the office, shopping mall, anywhere. So if anything like a person is having difficulty with speech, difficulty in raising one arm, or weakness of one side of the body, so they can be identified, and rather than going to any smaller center or to a cardiology center, they can come to a place where stroke or comprehensive stroke treatment is available.
Okay, wonderful. So, Dr. Memoona, I want to ask you, we're talking about the symptoms here, but how can we can identify it with certain, by FAST as well, but what also happens is that it's also genetic. Is that correct or not?
Okay, genetics play a small part. When we talk about the causes of stroke or the risk factors, we usually divide them into 2 main.
Right.
One are the factors which are modifiable and the others are non-modifiable. For example, increasing age is one of the risk factor for stroke. Like certain, you know, race, ethnicity, these are the factors that you cannot change. But there are the main emphasis of, you know, of the physicians, and the main emphasis of having these stroke days and, you know, increasing this awareness is that there are modifiable risk factors which you can change, and then you can decrease the risk of having stroke. Because, you know, in Pakistan, we are a poor country. People don't have access to medical to facilities. The treatment is very costly. So if we work on prevention, that is, you know, the key in our for our society. So the main risk factor for stroke is high blood pressure or hypertension.
Yeah, we will definitely talk about the risk and, you know, what is involved, or, you know, and we'll definitely talk about the prevalence of stroke over here in Pakistan. But then my question stands at large as well, because I went through that situation. FAST is obviously all of those symptoms with which you can check. That means that the person is obviously alive, he's in his senses, he's conscious or she's conscious, and you can obviously check that. But for example, if somebody fainted right in front of you and he or she's not getting up, how would you realize that it's not a heart attack or a brain attack? How would you differentiate? Do we have anything for that as well?
I mean, if somebody has fainted, definitely a layperson can't assess him anywhere. This situation may arise anywhere up in community. So the thing is, apart from heart attack, we should also consider there can be something else.
All right.
So the important question is, every person who faints is not heart attack always.
Exactly.
It can be a brain attack. So, I mean, when we are called in emergency room, there are lots of persons who come in with unconsciousness or with fainting. So basically, they need to be assessed, and then appropriate investigations has to be done.
All right, so I
They
think
need
what-
to have basically, if someone fainted, they should have an ECG, but they should have a brain scan also
Okay.
to rule out that this is not because of
So
brain.
I think for a layman, the best thing to do is that to go to a hospital where
Go to
there's
the ER.
cardiology department as well, and then
And the
there's this
neurologist
neurology department as well.
Yeah, okay. Now, once that has happened, once you've taken them to the emergency room and these things have happened and it's been identified, delayed identification of a stroke, what can be the consequences of that? Let's talk about that.
I mean, stroke is treatable. Okay, so up in the Western world, the stroke treatment started, I think, somewhere in mid-90s after like big research and big trials. We have started this treatment in Pakistan in last few years. Stroke treatment now is very similar as we treat heart attacks.
Right.
There's a very strong blood thinning injections that is given in a certain type of strokes. Actually, there are two types of stroke, as Madam has said. One is a bleed stroke, where there is a bleed in the brain, where normally we don't do many interventions depending upon the size of bleed. But the common type of stroke is a clot stroke, where a blood clot is formed in one of the arteries and it causes death to the certain part of the brain. Now, if that kind of stroke strikes, the most important is time, because at time goes the area of the brain that is affected by decreased blood supply that becomes bigger and bigger. So, if patient comes to a unit or to a hospital where there is a neurology center, where there is a stroke center, patient can be assessed. After initial assessment and after a brain scan, if there are no other contraindications, normally there is a very strong injection that can be given to burst that clot. So that
Okay.
is called stroke thrombolysis. The injection is called TPA. So that can be given in first 3 hours. So that's the importance that each and every minute after any patient develops weakness on one side or patient becomes faint and he has got a stroke on the back of the brain, then each and every minute is important. Patient should be hospitalized as early as possible. And in hospital, now stroke is regarded as one of the highest in terms of emergencies. Stroke team is alerted. Doctors come to the patient within few minutes. We do all assessments, all investigations within a matter of minutes. And if patient is a candidate for treatment, then treatment is instigated within first 45 minutes
Okay.
after arrival to the hospital.
So hopefully, okay, so if it's been identified in time and within the 3 hours, you can give that injection TP?
TPA.
TPA, right. So what are the other, okay, say, because sometimes there are delays in the diagnosis, so what are the other treatments available?
So the main treatment is thrombolysis, which is time-limited treatment. But when the patient came in the hospital, he is assessed and he is investigated. His blood pressures are monitored, his oxygen saturations and all the vitals are monitored, and then he's admitted in stroke unit and they are given blood thinners. They are given treatment for
Okay.
cholesterol and all those.
Okay, we're going to discuss the other treatments available and what happens if they don't get treated in time. But we're going to go for a short break, and when you come back, we'll continue our conversation. Stay tuned.
Good morning. All right, ladies and gentlemen, welcome back. And for everybody who just tuned into PTV while you're watching World This Morning alongside Shazad and Mine, for everybody who just tuned into PTV Global, it's the same, obviously. But then today we are discussing stroke, and because of the fact that yesterday it was World Stroke Day, and this year's theme is Face the Fact, Strokes Are Treatable. And right now we were talking about different treatments which are available. Earlier they were talking about the different injections which can be actually given to the person who's suffering through the stroke. And those injections can be given within the 3 hours of the stroke. But now the excessive treatments, or what happens next, is what we are discussing with our experts over here in the studios. Yes, go ahead.
Okay. So, apart from thrombolysis, the other thing that makes a difference in the recovery of the patient is admission to a stroke unit. Just like a CCU, a stroke unit is a place where we admit the patient in initial phases, where a multidisciplinary team take care of the patient, including the neurologist, the rehabs team, and the nurses, the psychologist, and they are monitored because the first 3 to 5 days they are important because in some of the strokes get worse than that. So they need monitored, their blood pressures and all the things are monitored. They are investigated that what is the exact cause of the stroke, and the treatment is then uh, titrated according to that.
Well, one more thing which I wanted to ask was that, within over here within Pakistan, what happens is that people a lot of time they're very scared to get their stroke treated. They do not want to go for operations, or they do not want to opt for them just because of the fact that it involves brain in it as well, and they're scared. And then the death toll was quite high in the early phases when people wanted to get their treatment done. For example, when we talk about 90s or the early 2000s as well, people never wanted to get it treated. They would probably opt for rehabilitation processes. People would come in, give them massages, move their hands, and they thought that they were going to get better. Do you think that these situations changing over here in Pakistan?
I mean, it's very gradually changing. Now, there is a start of the acute treatment along with stroke rehabilitation. So still, we are not near anywhere. It needs lots of campaigning, lots of public education, because lots of myths have been associated with it. As you said, that many people, they don't come. And in our daily practices, I normally see patients who come to me after 6 months or 1 year after stroke.
Oh my God.
And I mean, there's lots of research, as Madam has said, that patients who are admitted to the stroke unit directly right after their stroke, their outcome as compared to the person who is not admitted to a stroke unit, but even treated in a ward, is different. And somebody who is not coming to hospital, story is entirely different. They normally comes with lots of other complications.
Right,
Okay,
but what are the
so-
figures over here in
Yeah.
Pakistan? I mean, for how many people get a stroke over here within Pakistan, and then how many people go to the hospitals for treatments? What is the prevalence ratio?
I mean, on average, I think it's 250 people per 100,000. They get stroke every
That's
year.
quite high.
So it's a quite high number. But how many patients who come to the hospitals and who are treated in the stroke units, we don't have got the exact data,
All right.
because
Okay.
we don't have got many stroke units.
Okay, so now in regards to this, because this is a very important situation that we need to highlight, but what are the complications that can happen with delayed treatment or rehabilitation?
One of the most common and the most fatal complication is aspiration pneumonia.
Okay.
There's a common practice that when someone has stroke, people try to feed them. And just like they have weakness of the body, they have problem in taking food orally. So when you try to give them orally, what happens that the food, instead of going to the food tube, they go into the trachea or the air tube. And that leads to pneumonia, and that is one of the major causes of mortality or death after stroke. So if we just decrease this rate, we can decrease the mortality by 50%. Yani we
Okay.
can save half of the people who have stroke if we don't just please don't feed them right after that, before they are evaluated that they have a safe swallow. Then the other complications are other infections like urinary tract infections. Then they have contractures, bed sores if they are not properly rehabilitated. So
Okay.
you cannot.
And it gets difficult for the family as well. And I think
Yeah.
you said it very wisely, that if, for example, for all those viewers who are out there, if you have had such an unfortunate situation at your place, if somebody fainted, if somebody's not feeling well, please do not feed them. Because over here, what we do is, bring a glass of water, please, quickly. Give him or her water,
Yeah.
give him food, give him to eat something. And they're going to throw up suddenly, honestly. And then there might be lesser time left to what we could have done better.
Okay, so what are the other actions that the family can take when this is happening?
I mean, first, don't feed them.
Yeah.
Second, there's common practice that their blood pressure gets checked. And even people, what they do, they try to bring blood pressure down by putting medication or drops underneath the tongue. So blood pressure goes down. And that can cause serious effect on the natural recovery of stroke itself.
Okay.
So the most important step is not to give anything to eat and drink. No action in terms of medication like bringing the blood pressure down. Patient should be very safely shifted either by an ambulance or by a car to the nearest neurological or a stroke center.
All
Okay,
right.
and I'm sorry, I just wanted to just highlight a bit more because we've just touched upon the complications that can happen after a stroke. But what else can happen if what are the other complications that can happen?
I mean, stroke, as we have already discussed, is one of the leading cause of disability.
Yeah.
And in our part of the world, because of all these risk factors and they're not properly treated, it's even more prevalent in young population.
Okay.
And we see lots of patients who are in working age group.
Right.
And they lose their job.
Okay. Now, in regard to disabilities, what kind of disabilities can happen?
I mean, it can affect your disability-wise. It depends which part of the brain is affected. It can affect your vision.
Okay.
It can affect your movement. It can affect your cognition, your intelligence, your memory, and then your daily activities of living.
Okay.
All right, so when we say
It's a
that
serious
that
effect.
certain parts of your body, the movement becomes slower, does that really mean that it's affecting the inner organs as well, or it's just these organs with which we function? I mean, for example, arms, limbs. Is that what it affects, or the inner organs as well? For example, if it's on the left hand, if it's on the left side of the body, is it going to affect my heart as well? Is it going to affect the blood flow of all the organs which are in there, or not?
No. It's not like it will affect your organs or your other viscerals on that.
So it's just the movements which are going to be hindered.
It's basically it depends upon which part of the brain is affected, and either the motor control or the movement, or sometime sensations or feelings, or sometime your coordination or your balance, but not actually the
because it's related to the brain.
To the brain.
Oh, I get it now.
Yeah, exactly.
Yeah.
So yeah, it's just
But it can
that's what we're
affect
for.
your heart rate, or it can affect your respiration if the respiratory centers or the cardiac centers of the brain are affected, because brain basically controls all these organs. So if that is affected, then there is problem.
But then
with
how does a
respiration.
stroke affect a person himself or herself, and then their family as well? I think that's something which everybody needs to know.
Yeah, because unfortunately stroke in our country doesn't affect one person, it affects the whole family, because we don't have social services department, we don't have health care or insurance or things like that. So, and unfortunately stroke affects in our people 10 years younger as compared to the Western world. So if their average age of having stroke is like 60 or 65 years, we have it at 50 years, and you thought of person who is active, who is doing job, and then all of a sudden he is not working, he is disabled. So not only the family has to take care of that patient, but this family has to then earn, someone has to earn also for that family also.
Okay, so there's knock-on effects of the situation. Now, in regards to someone who has suffered a stroke, how regularly do they need to keep seeing the doctor, and for how long a period of time?
Normally, our practice over here is once patient goes home, either from the stroke unit or from rehabilitation, I see them after a week. And then where we assess how patient has been in the last week at home, how family is coping, and what else is needed. And then normally patients are, depending upon individual patient needs and the type of stroke, 6 weeks, and then it can be increased to 3 months to 6 months.
Okay.
But they need to be seen regularly.
But why do you think that there's a need that they need to be seen regularly? Because it can get worse. For example, if you got a stroke, you're treating it already, you're taking the medication, can it get worse, or can you get another stroke then?
I mean, stroke is normally associated with lots of complications. So, and these complications can arise anytime during the course of disease. So these complications needs to be regularly monitored, and they need to be treated there and then. And also there are lots of other risk factors which are the cause of stroke, so they need to be monitored.
Okay, and that's another thing I wanted to come back to, because we just briefly touched upon the risk factors. So what are the other modifiable, you said, risk factors that we need to be aware of?
The major risk factor is hypertension. and unfortunately Pakistan had, people here had 1 in 3 person had hypertension,
Right.
and 1/3 don't know that they are, they have hypertension,
Okay.
and if they had, they are not treating it.
Okay. So how do we? How can
So
we tell if someone has hypertension?
they have to, check their blood pressure regularly. Then the other causes are diabetes. That's one of the major risk factor. Cholesterol, high cholesterol, dyslipidemia. Smoking is one of the risk factor, major risk factor for stroke. And then obesity, sedentary lifestyle. We don't, walk.
We don't exercise.
We don't
We eat fatty food. We love
Yes.
sugar too much.
We like shanwari,
Yeah, yeah. We want to
Nihari
eat
and
mutton, and then we do not want to exercise. I mean, for all those people who are food lovers, it's good. You should always be happy about what you want to eat, but then please make sure that you having a normal amount of that food, that particular food, because over here we love cold drinks so much. We love to
Yeah.
eat or probably drink all of those, manufactured juices, which we do not know what they put in. And then we do not want to get our blood pressure checked. We do not want to go to the doctor once a year at least, that what's going on. We do not want to exercise.
So basically, anything that we, everything we can do, we're not doing it.
Yeah, we don't do
Or
it. I mean,
preventable.
people over here do not like it. And other than that, I think it's my observation that all of the hypertension, obviously, this is something which you cannot see whether the person's going through or not. But all of these other risk factors, they are there. You can obviously witness them. But then for all those people who are slim, who look after what they're eating or not, even they get through this as well. So, I mean, it's not done that these are the only reasons. It can happen to anyone.
It can happen to anyone, but it's
Increased.
said that, if you follow the simple 7 rules,
Yeah, what are those?
then simple 7 rules are: number 1, you check your, blood pressure regularly. Don't eat, control your sugar if you have diabetes. Walk regularly, at least 30 minutes per day, and do not smoke. Eat healthy diet,
Okay.
and avoid stress, and cut your cholesterol.
That means don't talk to your wife.
That's if you find that
want to avoid
situation.
stress.
Okay, someone's going to be in trouble. But okay, and what is the last rule? Because that was 6. I counted 6.
Yeah, there's one more.
It was
Cholesterol?
It was cholesterol.
Okay. Now, so now adopting these kind of lifestyle or this kind of lifestyle, it can just decrease your risk of having a stroke. However, once you've had a stroke, and we've talked about how regularly you need to see the doctor, but for how long does the rehabilitation process take on average within Pakistan?
Rehabilitation is a continued process.
Okay.
It never stops, and it also depends upon individual patients, because it is individually tailored according to patient needs. Someone who was a driver and who has lost half of his vision because of his stroke, so for him, he's not able to drive.
Yeah.
So basically, providing him with something, adapted cars, or with some glasses to increase his vision. But as compared to someone who has got a dense weakness on one side, he may need rehabilitation for a longer time. So it's individually tailored according to individuals. And it can be anything for an institution or institution rehabilitation. It can be anything from 4 weeks to 12 weeks.
Okay.
And then it can be shifted, the care can be shifted to the community.
Okay.
And as we've already discussed, we don't have got an integrated community system where patient care can be shifted. So here we normally educate families
Okay.
so that they can look after patients at their homes.
Okay, but the
Okay.
normal practice which I have witnessed over here in Pakistan is that, for example, if somebody gets a stroke, what they do is that obviously they'll go to a doctor, they'll give them some medicine, they don't want to get it treated furthermore. They'll come back home, call a physiotherapist, and call him for the next 10 years to make sure that the motor senses are, improving. But they do not improve. Let's talk about that as well, because people are not aware of it. They think that the physiotherapist is going to be of some help. Is it correct or is it not?
Physiotherapy do play a role, and they play a very important role. But then, as you go to a doctor for regular assessments, you need to be assessed for your rehab assessments also.
Okay.
Because you don't just need a physiotherapist. When the power is improved, you need, an occupational therapist that works on functionality.
Yeah.
And then you also need, speech therapist who works on your speech. So it's not just a physiotherapist. And if you are not improving, or if the patient is not improving, then he should, see a physiatrist or his doctor to see what complications or what are the causes that.
Because the thing is, at the end of the day, it is
improving this.
treatable, so there
Yeah.
should be no reason for someone not to get better, correct?
Yep. Yeah, and as you said, that most of the people here, they think that physiotherapy is only rehabilitation. So that is actually a wrong notion. And that's what we need to actually emphasize, and we need to spread this message in the community. It's rehabilitation is not a one person's job.
Right.
It's not only physiotherapist, or it's not only a doctor. And that's why the answer to the question we said earlier, why a patient needs to be seen regularly by a doctor who has got a stroke. Because his rehabilitation and his care is a continued process. And rehabilitation, again, as I said, it's tailored according to individual needs, and it can vary from time to time. So different professionals has to be involved. It's not only just massage or physiotherapy.
Yeah,
Okay, so we've
because you
learned
know
a lot
what,
today.
what I was trying to share with our viewers was that, for example, if a certain part of the brain is dead, obviously, first of all, the doctor can help you. And now, what do you think a physiotherapist would do? I mean, even if he's trying to move your limbs up and down like a half an hour or an hour, the sensors which work over here and tell them that, the arm is going to move. It's not going to move because the sensors are dead, right? But how do we bring them back to life? Because this is something which is new for me as well. And for all those people who suffered through a stroke, they're still not better. I mean, all those people whom I have witnessed. So what are the treatments? Because this is what I'm not getting. You told us about the injections and the other treatments which are there. But these are some basic treatments, aren't they? So, for example, if a certain part of the brain is dead, how can we bring it back to life?
The part of the brain that is affected by the stroke, unfortunately, that can't be revived. The cells that are dead, they are dead.
It's gone.
Yeah, the aim of acute treatment is in first couple of hours or 3-4 hours, when the area of the brain that is under threat because of decreased or lost blood supply, that can be revived.
All right.
So it's basically the area of the brain that is under threat for to be lost in next few hours, that can be restored by that injection.
And then what type of surgeries can be done as well? Are there any other surgeries which can be done to get rid of that clot?
I mean, there are not surgeries that we can open brain and we can take that clot out, but there are some interventions that are being researched, and they're coming into practice, where just like angioplasty in the heart, they can go up into the blood vessels in the brain, and they can take the clot, retrieve the clot out.
And adding to that rehab part, the physiotherapy, we start, ideally the patient who had strokes, the physiotherapy should be started right from day one. And physiotherapist, what the physiotherapy or the rehab process, what they do is the cells that are dead, okay, they are gone. But there's a process called neuronal plasticity, or you say that, the neighboring cells which are not dead, they take up the function of those cells.
Okay.
So the rehab, and not only just physiotherapy, that includes, that I mentioned, that occupational therapist and, the whole team,
Yeah.
they work to improve that functional, loss.
Okay, so that's why it's a collective effort
Yes.
rather than one area. Okay, wonderful. Any questions?
Yeah, what I wanted to ask right now was, since we've talked about all the therapies which are available as well, what we need to do, what we do not need to do. Now, for example, if somebody's going through it and he or she's not getting better, then what are we supposed to do? Are we supposed to go somewhere outside Pakistan as well if the treatment's not available? Let's be honest, because all of those people who suffer through it, half of their life is like they do not enjoy it.
It's difficult.
Yeah, it is very difficult. So till what extent do we have all of those treatments? And then from where onwards can we actually look for help from outside Pakistan?
I mean, we are establishing these stroke units and rehab centers. It's going to take a little bit of time when all these services would be available. Now, rehabilitation, it depends upon patient's initial injury to the brain and how much treatment he or she had initially. Rehabilitation after stroke, we have to set certain goals, and they are basically, as I said, tailored according to individual needs.
Right.
And they have to be realistic, as patient can achieve those goals or not.
Okay.
In few cases where there are big strokes, we know that these patients are not going to improve to an extent that they will go back to work.
Okay.
There are certain patients where we can achieve certain goals that they may be able to walk, or they may be able to go back to their work in not the same capacity but to a different capacity. And there is a third group where we, with all these rehabilitation input, involvement of all professionals, they can go back to the work in the same capacity.
Yeah.
So it has to be different from person to person.
All right.
There's definitely a group of patients with big strokes. They don't improve to an extent that they will exactly back to the same functional level as they were before.
Yeah.
Okay.
And then there are people who actually go back to that, but it's because of the fact that they had a stronger will. They were motivated, they were determined that we will get better and we will do whatever it takes. So how do you guys motivate your own patients that, okay, you guys will be fine? Because initially, it's even hard for them to stand up or to walk or to speak. How do you motivate them, and how do you think the family can do it too?
Yes, for that, post-stroke depression is very common, and that's obvious, because if someone is working, he's active, and all
good.
of a sudden he's just dependent on others, so that's one of the major cause of depression after that. So for that, we, as I talked about, we have a a group of whole team. So that team includes also psychologists and neuropsychologists who help that those patients to come back to to life.
Okay.
And then there are certain medications that we give for certain small time, so that their depression
They
can
can
be
get
improved and they can get better.
Okay,
Very
wonderful.
nice.
Great. So I think that's all of the questions that we have. Thank you so much for your time and for raising awareness and teaching us as well a lot about what a stroke is and what is the situation within Pakistan. But at the end of the day, we've realized that it is treatable. It is, there are certain measures that you can take to prevent to decrease the risk that you are at.
But one last thing which I wanted to ask. Thank you very much. Well, we did it, but then it was in my head. It was bugging me as well,
Okay,
so I thought I
awesome.
should better ask it. Now that is, we are saying stroke is treatable.
Yes.
We're not saying stroke is 100% curable.
Okay.
That makes a lot of difference, right? So which line would we go with?
Stroke is treatable, and majority of the strokes, 80% of the strokes are preventable.
And that gives me quite a lot of hope as well.
Great.
And ladies and gentlemen, as we earlier mentioned, that hypertension, diabetes, there are other diseases which can actually link on towards strokes as well. Please make sure that whatever you eat, it's healthy. You should go out for exercise. There are 7 rules as well. And those 7 rules were, let's just, reiterate them as well. Eat healthy, 30 minutes of exercise.
No smoking.
No
Check
smoking.
your blood pressure.
Check your blood pressure.
Check your blood pressure.
Limit
Cholesterol.
Cholesterol.
Sugar.
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 Well, we said diabetes.
Diabetes already. All right.
Okay.
One last.
Avoid stress.
And
Not
avoid
stress.
stress, yes. So that's a very long task, but we can all do that. Do log on to our Facebook fan
Which
page,
is with the name of World This Morning.
our Twitter page,
World This Morning without a G.
our Daily Motion and YouTube
World This
page.
Morning once again.
And the repeat is
5
at
past 11 p.m. Till
Have-
the next time. 1,
have-
2, 3. Look after yourselves. 1, 2, 3. Good morning.
Good morning.